And now, we bring you the following live press announcement from D.C. Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Good afternoon, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and we're here this morning in the recently renamed Marion S. Berry Jr. building, also known as One Judiciary Square, one of the district's larger office buildings. And this is also where we have been providing our COVID updates throughout our response and recovery. So we are happy to be in the Mary S. Berry Jr. building. I'm joined today by members of my team, LaQuandra Nesbitt from DC Health, Chris Geldhart, and Chris Rodriguez representing our Emergency Operations Center, as well as Deputy Mayor Falchicchio, and Councilmember Kenya McDuffie has joined us today. We will, at the end of our presentation, talk about some very big initiative in the district's recovery efforts. Before I get to that, I want to remind everybody about DC Health's partnership to get more people vaccinated for the flu. And this Monday, November the 23rd, we are having a senior flu shot day. DC Health is partnering with more than 25 pharmacies in the area to provide special hours for DC seniors. So please, seniors can get a flu shot in any of those participating locations, and go to dchealth.dc.gov/flu for more information on DC Flu Day. I also want to remind everyone of where to go to see the district's dashboard that you can follow, and there are lots of ways to look at the data related to our experience with the coronavirus. And here's where we are today. We report 156 new cases of COVID, and sadly, 5 Washingtonians have succumbed to the virus. We, of course, watch this data very closely to adjust the district's response, and we are watching it especially closely now. You notice that there's a color coding to this dashboard, and again, there's more information on the coronavirus.gov website of where we want to be for each of those categories. We are also making some additional testing capacity available in the district. And I want to acknowledge and thank our team at HCMA and Director Geldhart and the operations team that is leading our testing strategy in the district. It has certainly evolved to be a very robust system of free testing for DC residents, and we are very, very proud of the system that we have stood up in a very short time. On Monday, these changes to our testing sites will go into effect, and these updates to the schedule and process will make our already robust testing system even more convenient and sustainable. The first big change I want to announce is that we will be adding a site at Nationals Park. We're going to be using their garage to serve as a public testing site. That site will be open Monday through Friday from 2:30 p.m. To 7:30 p.m. So please note that change to our testing schedule. The next update is that we are also expanding the hours of our citywide testing sites. So the firehouse testing sites, for example, we will add a half hour at the beginning and at the end. So the current hours are 3 to 7. The new hours will be 2:30 to 7:30 p.m. at the firehouse testing sites. For the citywide sites, F Street, UDC, and Anacostia. When I say UDC, that's at Bertie Bacchus near Fort Totten Metro. The current hours are 9 to 1 p.m. The new hours will be 8:30 a.m. to 1 p.m. So there's an additional half hour there. I also want to point out that we're adding some time around the Thanksgiving holiday. The firehouse testing sites will be open on Sunday the 29th from 12 to 4 p.m. And those 4 sites are listed on Sherman Avenue, C Street Southeast, Florida Avenue Northeast, and Connecticut Avenue Northwest. Finally, the last big change, and it is a very important one, because it is going to help us with the sustainability of our testing program. And that is starting Monday, we will begin collecting insurance information from people who come to the public testing sites. So I want to be clear that anyone who needs this test will be able to get a test for free. No one will be turned away, and no one will be charged a copay. But by collecting insurance information, we can make better use of district resources. Insurance companies should be paying for the test, and we want to make sure that we collect that information so that they might. If you do not have insurance, or if you need a test and for some reason don't have that information available, you will still be able to get a test. The process is simple, and we continue to encourage people to register online so that you're not trying to enter information into a little screen when you get to the site. You don't need an appointment. We don't offer appointments, but you can pre-register so that you're not doing it standing in line, and you will probably also have your insurance information handy. So please note that change. And so for the complete schedule next week, it is listed. We continue to show the additional hours on Sunday, and on Thursday, we will be closed in observance of the holiday. We will be open for testing on the day following the holiday on Friday. Before we finish talking about testing, I also want to reiterate the importance of using testing in addition to wearing masks, social distancing, and practicing good hygiene. Another way to think about it is getting tested doesn't stop you from getting COVID. So you still need to do everything that you can do in your power to avoid contact with the virus. And the reason we are advising you to get tested 3 to 5 days after a possible exposure is to reduce the likelihood of getting a false negative. The science tells us that if you get tested 1 or 2 days after a possible exposure, there is a greater chance that even if you are infected with the virus, you will produce a negative result. So we want you to be careful about using testing properly to help you manage your health. We developed a scenario to just emphasize this fact. And I wondered, where's Dr. Nesbitt? There she's, okay. I wondered if Dr. Nesbitt wants to go through this scenario. Sure. I can, or?
Sure, Madam Mayor.
Okay.
So as you mentioned, we have to make sure that we use testing properly in order for it to have its benefits. Testing is not a treatment for COVID. It can be used as a preventive option, but only if it is used appropriately. We have to be careful, and in this scenario, we're talking about a woman who plans to have dinner with 5 members of her extended family on Thursday. The Saturday before the dinner, she goes to brunch at a friend's house. She takes off her mask to eat, which is what most of us would do, and after the meal, she poses for photos. Another guest at the brunch, unbeknownst to her, has COVID-19, is asymptomatic, and does not know that they are infected. On Monday morning, she goes for a test at a testing site and gets tested in advance of her plans on Thursday to have dinner with her family. On Wednesday morning, she receives a negative test result and informs her family that she will be coming over for dinner on Thursday and that she does not have COVID. The woman goes to dinner on Thursday believing it is safe to do so, as she has received a negative test result, takes off her mask, and eats at the table with her family. On Friday, she finds out that the brunch guest from the previous weekend tested positive for COVID-19 and that they were infectious during the brunch. She gets tested again, and this time she receives a positive test result. She realizes all of her family members were exposed, and 3 go on to develop COVID-19. So this is the type of situation that we try to get people to be familiar with, to recognize the importance of continuing to practice social distancing, wearing your mask, and being vigilant about your activities, because a negative test today can be a positive test tomorrow. And asymptomatic individuals have the risk of spreading COVID-19 unbeknownst to them, to their friends and family who they are enjoying time with. Thank you, Mayor.
Thank you. And we also wanted to just reiterate something else that we learned from talking to people who are contact tracers, talking to people, and that is that household spread continues to be a concern. So contact tracing data indicates that many Washingtonians are still getting affected or likely getting affected at home. So while they may not be participating in high-risk activities or a lot of high-risk activities that put them at risk, someone they live with is. So we want to continue to encourage these types of conversations at home. And some of them can be difficult, but we want you to be cautious and transparent about your exposure levels. And those are the people that you live with. Do everything that you can to protect vulnerable family members and require all guests in your home to wear a mask. I asked the team to come up with just some shorthand things that DC residents may use for friends and family and at-home use. I noticed in my travels throughout the city that a lot of our businesses are just using the signage and graphics that DC Health and our team came up with, and we loaded it online for their use. They simply print it out and use it. So why not try something similar at home? So these posters will be on our coronavirus.dc.gov website. You can post them at your home. You can send them to friends before coming to your home, so they know the rules of your home. And they also know that the Dr. Nesbitt told them to do it, because it says, from DC Health. So you don't have to have any fights over whether your rule makes sense. You can just tell them that, Dr. Nesbitt told you to do it. So those are going to be available at our DC, at coronavirus.dc.gov website. Next, we want to talk about something very important. We've also talked many times at this briefing not only about the tremendous public health toll of this virus, but also the economic disaster that it has created. For many of our businesses in particular, they had thriving businesses. They employed DC residents with good wages that allowed those DC residents to take care of their families. And we are all very focused on how we can smartly invest in keeping those businesses alive. In fact, I want to share some data that the DMPED team has provided. And DMPED and John Falchicchio have been updating the community workers and businesses every week with a check-in and also taking questions. But here's just a quick update. 56,000 jobs have been lost between last December and this September. About 63% of those job losses come from 3 sectors. And you can see here that as of September, employment in the leisure and hospitality industry has decreased by 41%. Beyond the numbers, we know that these are real workers who are also struggling to make it. They're DC residents struggling to keep their businesses afloat. And the longer this goes on, the worse it gets. So today we want to talk about the Bridge Fund. The council has also talked about it, and in fact, I invited Councilmember McDuffie today to represent the council. We worked together over the summer to pass legislation that allows us to provide up to $100 million of much-needed financial support to local businesses. So today, we are proud to announce that we have set up those funds to get out into the community. And the Bridge Fund will focus on strategic investments in the hard-hit sectors so that we can support workers and help businesses make it to the other side of this crisis. Here's the breakdown of funding. And John and Councilmember McDuffie will talk about the specifics of these tranches of funds and how we will administer the Bridge Fund. But $35 million will go to restaurants, $30 million to hotels, $20 million to businesses in the entertainment sector, and $15 million to retail businesses. There will be an equity inclusion set aside of 15%, 50% of the restaurants, I should say, and retail funds will go to disadvantaged businesses, including small businesses owned by economically disadvantaged businesses or women majority-owned businesses. That is equal to $7.5 million set aside for these businesses, is of course a floor and not a ceiling. So we will post more information about the Bridge Fund, including eligibility and requirements on the coronavirus.dc.gov website. So we announce these because we know that businesses are right now struggling, and we also know that the days ahead can be significant for them too. So this is a very important announcement, and it has been a very fruitful partnership with our team and the Council of the District of Columbia. So I wanted to say thank you, Councilmember McDuffie, for all your hard work with us. With that, we will take questions. Yes.
Could you explain a little bit more about how insurance will work? Do you know how much insurance companies will be paid? If there's a copay, how would that work? Would somebody have to give that money at the time of testing?
Well, I've already said that nobody would be asked to make a copay, and I'm going to ask Dr. Nesbitt and Director Geltart to speak to exactly how it works.
So in the District of Columbia, individuals are not to be charged a copay for COVID-related services. That includes testing and treatment and hospitalization. So bear that in mind. And we would encourage you that if you, after using your insurance at any of our public testing sites in the District of Columbia, if you're insured by a District of Columbia health plan, if you experience any copays, co-insurance, to reach out to your health plan or the ombudsman in the District of Columbia to assist with resolving those issues. But individuals should not be experiencing any issues with copays or co-insurance for seeking testing services in the District of Columbia through our public testing sites. And as the mayor mentioned, using your insurance, you're not going to be asked to provide a copay at our testing sites. And if you don't present with your insurance card, you will not be declined any services.
Dr. Nesbitt, I understand you're adding these extra testing sites and testing hours because there's such a demand right now for testing. And I wonder if you could tell us some numbers of how many people are getting tested right now, and whether we have enough tests. Are we going to run out?
We are seeing an increase in our numbers at our testing sites. We're averaging between 3,500 and 4,200 per day that is an uptick in the number of testing that we've done in the past. We anticipate that numbers to still increase, which is why we are doing many of the things that we're doing for extending hours and opening additional sites. The one thing, your question of, are we sure we have enough testing materials? Right now, we have no issue with testing materials, and talking with our contracted vendor, our laboratory, we don't foresee right now at this current time having any issues. This is a nationwide, worldwide pandemic, so nobody can guarantee if that won't become an issue in the future. But as of today, we have enough testing materials to do the tests we need to do.
Why do you think it is that so many more people are getting tested now?
They watch the news.
Does Thanksgiving travel have to do with it?
There's a whole bunch. Several of us walk the lines and talk to folks coming to get tested every day and ask questions of why are you out here today. Many of those answers are, I believe that I was around somebody that has tested positive. Many of them are, I'm going to travel, and some of them are for work related. So there's many reasons why people come to get tested. The good thing is here in the District of Columbia, you can do that, and we have the infrastructure to support it.
Thank you.
Two questions. What's the average test turnaround time at these sites? I know we have an average for the city, but that includes nursing homes, which I understand. So what are at the firehouses?
So all of our testing that we're doing right now at all of our public sites, we say there's a 3 to 5 day turnaround on that. Currently, we're in the closer to 3-day time frame. We've been there for quite some time, but with the increase in numbers, the capacity at the laboratories is what it is. We're watching that very closely every day to make sure we're seeing when we may start to see some increases in that, and we are seeing a little bit of an increase in that, but we're still within that 3 to 5 day window.
And a second question, are you weatherproofing, or are you thinking of weatherproofing these outdoor sites? And yeah, you're nodding your head.
Yes. So one of the biggest reasons we did work with Nats Park and the Nationals organization to get the garage is so that we can do indoor. It's not really indoor, it's in a garage, but at least it's covered and we can heat it. What you'll see starting on Monday at our other test sites, at our Bertie Bacchus site, at our Anacostia site, and here at F Street, you'll see much larger tents that we'll be putting up over the weekend, so that part of the infrastructure at least can be covered and heated in the area.
Yes, Sam?
Yes, Mayor, basically, I guess with the insurance thing, the city gets some money out of this thing. Is that essentially?
Yes. So think of it as it's like we're kind of paying twice in some cases, because some of the people coming are insured with district supported programs, insurance programs, and then we're also paying for the test. So we want the insurers to cover their members as they should be doing, as if those members were going to their doctor's offices. That's another way to think about it. The same people who are in line at F Street could very easily be at their doctor's offices. And so we want to make sure that the proper places for those costs are being borne by the insurance companies when they should be. So we're asking people to please just take a couple of extra minutes, get your insurance card, pre-register, because that is in the long run going to help us with other parts of our recovery. That's money that we should be spending on other things.
The $100 million that you are going to be spending, is that HEROES Act money or what is
No, it comes from several, because there is no HEROES Act money. No, I'm just saying, I'm only venting my frustration, not at you, but at the fact that that the Congress hasn't moved those dollars and we really need them. But I think you may be referring to CARES Act. So I'm going to ask John to talk about where those tranches of money come from, and also look to Councilmember McDuffie if he wants to add to that.
Great. So the target of $100 million was actually set in partnership with the council. The funding sources are $20 million of CARES Act money and then $80 million of local dollars. And I'll defer to Councilmember McDuffie on the target of $100 million.
Yeah, so thank you, Deputy Mayor Falticchio and Mayor Bowser. The $100 million was based on an analysis that we did looking at the industries that have been hardest hit in the District of Columbia since the onset of the pandemic back in March. If you think about it, some of the data that the mayor mentioned, those industries like hospitality and leisure, restaurants, nightlife, sports, entertainment, they employed nearly 100,000 people and have since been decimated by the pandemic. And despite our best efforts, I think it's important to acknowledge that this $100 million bridge fund comes on top of various other efforts that we've worked with the mayor to implement since the beginning of the pandemic, including more than $30 million in micro grants and other funding, streetery funding. We had child care funds that have gone out the door. And so this is timely. But we also know in reality that despite this most recent infusion of funding, that there's still going to be some businesses that are really hard hit. But I want to thank the mayor and the deputy mayor for their efforts in working with the council on this, but also to thank the workers and all those businesses that have been laboring over the last 8 months to make things work, to make the ends meet despite these extraordinarily challenging pandemic conditions.
You noted entertainment. What is that going to go for? I'm just curious.
The amount I believe that they have in here for entertainment is about $20 million. And what the mayor's proposing, it tracks very closely to what was already proposed in the bill that I introduced and the council passed back in July. And so we did this in consultation with various business entities to help us inform, what they needed to look at the industries, again, that were hardest hit, looking at the data where we had most of the jobs that were impacted by the pandemic. And so this really is an investment in those businesses and their workers that they employ.
Yes.
Can I just follow while we're on this topic? Just a couple of questions about this. Will money go just to the business owner? Will there be money that will be earmarked specifically for employees? Do the businesses have to apply for this? Is there an application process that they'll have to go through? And when do you actually expect to see checks distributed to any of these businesses?
Crack at that. So yeah, think of this as one initiative. The Bridge Fund is a $100 million initiative with 4 separate programs in it. So you'll see on the screen there's the restaurant program, hotel, entertainment, and retail. The first one that we'll actually administer is the hotel program. The $30 million that you see listed, 20 million of that will be the CARES Act dollars. So it's critical that we disperse that funding this calendar year. And so we'll open up that application next week for the hotel program. We'll follow the model on the hotel program. We're most advanced on that program because it'll open next week. We'll follow the model of the Events DC program that launched earlier this year, where they had to use 80% of the money for payroll. So we'll follow that model as well. And then as we roll out the different programs, each program will have different use requirements, as well as different information that we'll ask for from the businesses when they apply. The businesses, though, should start to gather the information that we've asked for in previous grant rounds, and we'll post more information about when each grant opportunity will open, and that will open over the course of the next 5 weeks.
Just the last thing, when you might see checks actually start to hit businesses?
So for this, what we'll do is we'll have a period that each application will be open for a couple of weeks, and then we'll have a few weeks that we'll need in order to actually evaluate the applications, and then a few weeks after that is when we'll start the grant awards. Once a business gets the award, there is sometimes some information that they have to provide to us, and that sometimes is kind of a key factor in how long it takes to make the disbursements.
Yes. Yes.
Mayor, question about the teachers union. Not sure if you heard the announcement today, but the union says that they're not going to sign an agreement with the DC public schools to reopen for in-person learning. They're citing lack of clear public health guidelines, and lack of engagement with administrators and teachers around reopening plans. What's your response to that?
Well, I think it's unfortunate, given that the president of the teachers union indicated her support for an agreement after many hours of negotiation with us. I can't say that I'm surprised. She's backed away from other tentative agreements as well. It should be apparent that the goalpost, unfortunately, continued to move. However, our responsibility is to make sure we're responding to parents and taking care of children. And I'm pleased to say that the first phase of CARES has moved forward today, CARE classrooms. And those classrooms are open in schools across the city today. We will continue to work with parents and families and the partners who are making sure that those classrooms can operate in a safe way. Yes.
Dr. Nesbitt, could you give me your thoughts on the two strong vaccine candidates, Pfizer and
Moderna.
And the thing about it is, could you talk about the fact that there's talk that these, they'll be available either late this year or early next year, whatever that, early next year. When will that, do you have a sense of when will those vaccines hit the district?
Yes. Thank you so much for the question, and I'll have to answer this one and then leave for a prior commitment with the speaking engagement. But we are excited, like many in public health, to hear the interim analysis findings that both vaccines have over 90% efficacy, and wait to hear more information about the subpopulations for whom that effectiveness applies. So we will continue to follow that very closely, as well as the members of our scientific advisory committee. We held a meeting last night. And so we're enthusiastic about what that means and the promise that holds, and want to hear even more about the safety profiles, which I understand that data will be made available in the coming weeks as they apply for their emergency use authorizations through the FDA. What that means is, as the emergency use authorizations are applied for and hopefully received from the FDA, we will, as we have been in close conversations with our federal partners, begin to receive vaccine within days of those emergency use authorization approvals. The vaccine that we receive, as you all have heard, there's probably enough vaccine between the two providers, or the two manufacturers, the two companies, for about 20 million individuals to be vaccinated, because both require 2 doses. So we will receive enough for what we call phase 1 priority populations, which will focus on healthcare workers and first responders. And that could be, based on the timelines that both Pfizer and Moderna have spoken to publicly, maybe by late December.
Yes.
Hi, a question about our contact tracing data. So I know, Dr. Nesbitt, I asked, oh, you have to leave. Okay, well then, damn it. Okay, then I will ask another question about money directed to workers. I know you worked with Events DC to get money into the hands of like workers who don't qualify for traditional unemployment benefits, et cetera, namely undocumented workers. I wonder if that was a one-time check, and I'm wondering if there's anything like that. If you're are you looking to do that again?
We don't currently have a plan to do it again, but I think a lot of things get opened up if there is a HEROES Act, as Sam rightly brought up.
That was a mistake.
No, but it just happens to be on my mind. The federal government doing what it has to do, even in this lame duck period, to get money out the door, because they're going to be workers. Listen, we all know that we're going into winter. And there may be tightening and more people out of work, more people who have lost unemployment benefits, more businesses that are closed or shuttered. And this is not something that we can handle locally, that the federal government has to have a national plan. Yes. No, I'm going to take the last couple here.
Well, also speaking of the federal government, I wanted to ask about your thoughts about the upcoming inauguration. I know Chairman Mendelson has said he doesn't think in this time of social distancing it's safe to have a reviewing stand outside the Wilson building. Have you thought about what the district government should do for these?
Well, we're waiting to hear what the president-elect wants to do. And I think that's kind of a minor point, quite frankly, given what we're dealing with. Yes, Mark?
Yeah, thank you, Mayor Bowser. So can you just talk about where you're at? And I know Dr. Nesbitt has left, but we have now seen 7 straight days of daily case rate going up, rate of transmission going up. You know, daily case rate is in the red. It's gone from 13.2 to 23.1 in 7 days. And the rate of transmission is on the brink of going back into red. Just what do you say to residents who are seeing numbers here in the district go up, restrictions roll back in jurisdictions around us, and they're concerned that the numbers are going in the wrong direction and maybe DC should start rolling back restrictions here as well?
Well, what I say, Mark, is I kind of go back to where we are nationally and seeing numbers go up and seeing a patchwork of restrictions across the country. And I just know that that bodes poorly for all of the U.S. of A. What we need is a national approach. Having said that, we have been very deliberate in how we have loosened restrictions during the summer, never going to phase 3. I mean, how many times have you all asked me in this room, when are we going to phase 3? When are we, how many times you think? 100 times? When are we going to? Well, we've never gone to phase 3. We've never had bars open. We never had spectators at sporting events, for example. So we've kind of been very steady at phase 2. Having said that, our team is developing a what we want to. We don't just want to kind of throw something at it. We want interventions that we think give us the chance to drive our numbers down as we go into winter. So our business owners, our social gatherings, people can expect that we won't be able to maintain this level, and we will have, when we think that we can offer something that has the potential of driving the numbers down, to rolling those out. So no, we will not likely be able to maintain this posture, but we want to be able to make recommendations that are going to be successful.
I appreciate the candor in that. Do you have any timeline for that?
Soon. I'm not going to say when, but it'll be soon. All right, thank you.
We now return to our previously scheduled program, already in progress.